Hi, my name's Deanne Waterman, and this is my Session 2 project proposal for bringing ultrasound and trophon machine to our OBGYN clinic. The background on this project is that the OBGYN clinic I was working in recently closed. The providers, the practice manager, and I transitioned to another clinic which opened on October 1st, 2018. The two clinics have vastly different clinical operations protocol. The provider and patient needs have not changed, only the clinic setting, which is under a different physician's network. There is currently a lack of dedicated equipment, ultrasound machine and trophon machine, needed to care for the patients and keep the clinic running on time. The ultrasound machine is needed to provide scans of the fetus to check for pregnancy confirmation, positioning, viability, and for IUD contraceptive placement. Trophons are used to disinfect the vaginal probe for the ultrasound machine. The perceived need is that the clinic should have a dedicated working ultrasound machine with an additional vaginal probe and trophon machine. This would allow the providers to see their patients on time, decrease patient wait time, as well as keep the staff in the clinic maintaining workflow. In order to substantiate the need is to check wait times, which can be done through the electronic health record system. Additionally, through use of our patient satisfaction surveys, we are easily able to determine how these wait times affect the patients. I believe that of the Lean Six tools to help determine where improvements can be made, I believe that the process flow chart would be most helpful. This chart can help us determine the areas that improvements would make the largest differences or where there are issues around the process flow. Stakeholders in this project would be the patients, the providers, the medical assistants, the practice manager, the clinical operations team, the physicians network, and the providers and staff sharing the suite. Supporting stakeholders are stakeholders wanting to support this project, and they would be the providers, the medical assistants, the practice manager, and the patients, as each of these groups are directly positively affected by the implementation of these machines. The stakeholders who are not swayed either way but need to be informed would be the clinical operations team and the physicians network, as they may not fully understand the need for this machine, and they would be the neutral stakeholders. Resisting stakeholders. The only stakeholders who may believe this will have a negative impact on what we do and may resist would be the providers and staff that share the suite. They are specifically resisting due to the extra real estate that these machines will require in our suite. We already take a bit of extra room for all of our equipment, and the addition of these machines will require that we need more room in this shared area. A needs assessment will be used to address the supporting stakeholders, showing the need for a dedicated working ultrasound machine and trophon to keep the medical assistants in the clinic, maintaining workflow, and increasing patient wait time. The stakeholders that support the project would require more information to help deepen their commitment to the project. Additionally, through allowing them to have the full scope of information, they will be more adept to helping to explain this to others that either are not swayed or even those that believe this may have a negative impact. They should have a clear understanding of how they can help facilitate the change and implementation of the overall project and each of the individual pieces that they can help implement. The stakeholders that are not swayed either way by the project would best benefit from first understanding the costs associated with the project. In addition to this, proving to these individuals why they should support this project, specifically around how this will benefit the patients, customer service quality, and finally how this equates to increased revenue. Through helping the middle-of-the-road stakeholders more fully understand the benefit of this project, they will be more apt to not only be swayed but also help with the overall process of the project. Finally, stakeholders that believe that this will have a negative impact on what they do may be best benefited by understanding all aspects of this plan. They need to understand the structures of the project specifically because this is what they believe will create the negative impact. By understanding that lack of impact that this may have on their overall daily work, I believe most of this group could be swayed into at least being non-committal, if not supportive. The Christian servant leadership approach. Not so with you. Instead, whoever wants to become great among you must be your servant, and whoever wants to be first must be your slave. Just as the Son of Man did not come to be served, but to serve and to give his life as a ransom for many. Matthew 20:26-28. Just as Jesus came to serve the world, we are to give our lives to service to God and in service to our fellow person. When we approach, especially those that do not agree with us, with the understanding that we are approaching this project with the aspiration to serve the needs of our patients, in addition to serving the needs of the employees, and consequently benefiting those in the hierarchical top, we are not only doing God's work, but also approaching this from the right angle. We are here to serve others as Jesus would, to make lives easier for others, and this is what this project would do. Project goals. Having access to a dedicated ultrasound machine and trophon machine will allow for the providers to see the patients on time, rather than waiting to use the shared ultrasound machine or for the vaginal probe to be disinfected in the trophon located in another clinic located on another floor. Keeping the employees in the clinic rather than having to go to another floor to retrieve the ultrasound machine, return it, and disinfect the vaginal probe will improve employee workflow. These will in turn create positive effects and satisfaction by both employees and patients, improve productivity, and create more income, resulting in an increased bottom line for the organization. Requirements and tools for this project. In order to measure the wait time baseline, we will use the clinic's EHR scheduling system to determine where bottlenecks may appear. In addition, we will also use wait time audits at the front desk in order to help determine when there are increased wait times and how these bottlenecks are created. To also help with this, we may want to use process flowcharts to see where any additional process improvements may help positively impact our flow. Additionally, through patient satisfaction surveys, we can gauge the baseline for satisfaction based on wait times and the satisfaction after the implementation of the project. Finally, we would want to look at current income levels to determine if the changes implemented by our project will increase income for the organization. Literature review. Gavril helps us understand that through improving process, efficiency, and quality, gross revenues will increase to include an additional 2,118 patients annually. Medical staff is imperative in changing policies and structures to raise awareness and increase access to quality medical care. Milford, Strassel, and Sinsky show us that by increasing face time between patients, MAs, and physicians, wait times are reduced. This also benefited in the fact that while reducing wait times, satisfaction was improved for satisfaction for the physician, MA, and patient. Increasing time with the patient can take a variety of different measures, including but not limited to reducing administrative time, the time spent with paperwork, the decreased patient wait times by up to 7% per patient, and include a decrease in cycle time of an average of 6 minutes. Murphy, Vath, and Daigle help us understand that process changes in an organization make it less likely that the organization will slip back to the baseline that the process change was started from, and a well-defined control plan allows organization to quickly and easily address slippage in the organizational performance for the project. Stickler explains that Lean Six Sigma is a process that uses multiple tools and approaches, specifically using fishbone diagrams, process flowcharts, and the 5S process: sort, straighten, shine, standardize, and sustain, and others to improve patient flow and to minimize wait times. Tiber explains that project metrics showed team improvements of a collective 530 additional patients per day by improving wait time and on-time start rates. The post-product survey noted that of the 50 project team members, 82% had more effective solutions as a result of the process improvement, and 84% said that they could use the improvement tools again in the future. 98% of these said that they would recommend participating in another project. Through use of define, measure, analyze, improve, control, and value stream mapping, the planning team was able to put this together. BSM benefits in the fact that the end-to-end view of the process includes people into every step and measures time devoted to process steps of the cycle time. These lead a time logically through implementing solutions linked to causes and established best practices.